Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, my friends. Here, Joa Rivas with another podcast. It's Friday, so super excited to bring you a podcast related to health and wellness. As you know, I used to have scoliosis when I was 15 years old, and I started with this podcast as a way to spread wellness awareness about the posture, specifically about the posture, because I had scoliosis. My back pain affected my 10 years since 15 to 25. So basically, teenager life for me wasn't fun, and part of my first adulthood life, it wasn't easier. So now I'm actually almost 40. I'm moving towards 40, and I actually have no pain on my back. Normally, if I do have pain, it's because I'm not moving enough. And at least I managed to release the pain coming from the scoliosis. So this is actually a podcast that brings insights and professionals to share their knowledge with us and to give us easy solutions that we all can incorporate on our days. Today we have a friend. For me, I'm super excited because she's been my friend for a decade, and it's exciting when you actually bring close friends into your podcast. Sometimes we feel that we always share so much information, and sometimes I wish I can tell everyone what our conversations are about. And I invited today Dr. Basu Roy. She's actually here in the city of Toronto, and we have been friends for over 10 years. So it's exciting to have a conversation with somebody that I know very well, but also someone that is very passionate about wellness in all levels, not only about the inside, but the outside as well. She's a beautiful woman. If you are listening to this, imagine a very athletic, strong woman. And if you're watching this, you can actually see her beautiful face. So hi, Michelle, how are you?
Hi, Joa. It's so nice to be here. Thank you.
Awesome. Thank you so much to open a little space of your day. I know you're a very, very busy doctor, plus you also train, and you also are a mother of two beautiful kids. So you're actually very busy woman, householder, and you just open a space for all of us to hear about what you do. And first, I would love to hear about your journey beyond your bio, which I'm going to give a little bit of a short bio, because she definitely is not a professional, but she just loves to study. I just noticed that she studies so much. She actually has a bachelor in science in kinetics and nutrition. And then she moved into a naturopathic medicine with an osteopathy. And she continues studying, adding functional medicine as part of her practices. And also she is a great trainer and an athlete as well. She actually was part of the CrossFit Games in 2012 and 2016. So she keeps her body fit and strong as a woman. She understands how valuable it is to preserve our longevity. So this is part of what she has been doing and studying. I'm sure she's studying something, right? She's always studying something.
Yes, I'm actually learning lots more about how the body heals from an emotional perspective. So
yes, emotion. So like now she studies a little bit of psychology. You see, I know she's always studying something, which is awesome. It keeps her busy, and also learning that human is actually a very complex body, and we are a unit. We cannot separate our physical body from our emotions or from our spiritual part. So I'm very, very happy to have you here. But tell us a little bit about you specifically, because you actually have scoliosis too. So tell us a little bit about you. How did you develop this passion into fitness and wellness? And how was your body when you actually start training?
yes, so I have been an athlete since I was very young, always interested in different sports. I got into CrossFit more competitively 10 years ago. I did suffer an injury in my back over 15 years ago, and it was related to a herniated disc in my L4-L5. And it was a very difficult injury. I was not able to walk for over a year. And it did take some time to rehab the injury. I did a lot of traction, a lot of therapies. and a lot of internal work nutritionally to reduce the inflammation. And over time, it took many years, but I did build a lot of strength. And what I have found is to be able to build strength through the full range of motion when the joint is in its maximum position is very helpful in terms of keeping the integrity of the back.
So 1 second, you said that you actually had an accent. Can you please tell us more about this accent? I know you want to go right into the knowledge that you have, but we actually want to know more about Michelle, about what happened to you, because most of the time we are so passionate about what we do in life is because it's related to our story. And you just mentioned you actually had a L4 and L5 herniated disc. So tell us what happened exactly and when. How old were you?
Yes, so I actually, through x-rays, discovered that I have a sacralization, which means that there is a small fusion of my lower sacrum to my coccyx. So there's less mobility in that area, which makes me more susceptible to having herniations.
1 second, is this the spine bifida? No.
Spinal bifida is where there's actually an opening inside of the bone and the nerve roots are being exposed to varying degrees.
Okay.
Sacralization is where the bone is actually attached to the lower vertebrae where there should be a joint. So it creates less movement in that section where there normally would be movement.
Okay, so you were diagnosed with this at what age?
So I found out that I had the sacralization after I got the injury because I had some imaging done after the image.
And how old were you?
It was about 15 years ago. So now I'm almost 38. So when I was in my early 20s.
Oh, okay.
For me, before I started CrossFit, I was doing a lot of running. I was a competitive runner and I played soccer. And I loved running, but I think I realized what happened is there was a lot of structural imbalance.
Okay.
I was doing a lot of repetitive movement and not strengthening the joint properly, which put me at a susceptible place for the injury.
Okay, so you were a runner and a soccer player. Then you got into this car accident that actually opened this new, this function that happened to you. So you actually born with this, or this just happened as a consequence from your accident?
No, I was born with it. So it's actually a common structural shift that happens when you're, a lot of people have it and they're not aware.
Okay.
So I only became aware of mine after the injury when we were looking at the x-rays.
At the images. Okay, and this is through x-ray or through MRIs?
So it was through x-ray. So typically with x-ray, you can see any abnormality in the bone. MRI will show you any abnormalities in the soft tissue.
Okay. So that was when you were about 20. And then what? You continue running and doing soccer, or you just move into something a little bit more gentle? Because you said that you spent 1 year without moving, but I don't imagine you without moving. You have so much energy. What did you do in this year for rehabbing?
I biked every day and I did weight training.
Okay. Yeah, of course you had to do something. I don't imagine you're static. Okay, I imagine. Okay. You did biking, and then what else?
And I did also a lot of weight training. So I spent a lot of time to strengthen the joints. And it took a few years, but now at this point, after doing CrossFit and strengthening, there was not a specific incident that created the injury. One day I was just exercising and I felt a little bit of a shift. And then it was a lot of pain and the sciatic pain that I felt.
Did you take at any point muscle relaxers or any type of NSAIDs?
I didn't, but I did use a high dose of curcumin.
Okay.
And I actually found this to be pretty effective for me at a very high dose with curcumin. And I also was doing a lot of treatments, so traction, different types of muscle relaxation treatments. So it was some chiropractic, but it was mainly ART that they were doing to release the muscle.
And when you're saying about curcumin, can you please tell us that curcumin, we're not talking about the powder that is turmeric that we add on the food. We're actually talking about curcumin, which is a little different concentration, right?
Yeah, what's really interesting about curcumin is you would need to consume almost an entire bag of turmeric to get the same therapeutic dose.
Okay.
So I was taking one called Mariva. It's a product by Thorne. There are many, but I did find that this one had a good absorption. So it helped to lower my inflammation so that I was able to reduce the pain and go through increasing the blood flow through movement.
And this one comes with bioprint, no?
This one didn't,
Okay.
but maybe they have changed it now because it was so long ago.
Right. Okay. So curcumin was one of the ways to release the pain without taking muscle relaxers. And then you also did RTI, you say?
ART.
ART, yeah, active release therapy.
Yep.
And then you continue doing your biking and your movements. Just I imagine you start. Did you actually do some yoga and Pilates on this year that you were doing the rehabilitation?
I did at one point, but it wasn't actually for the healing.
Okay.
Yeah.
And what about the CrossFit? So when did you start actually practicing CrossFit as a student and got just in love with it and actually open your own facility?
Yeah, so that was over 10 years ago when I began CrossFit about 12 or 11 years ago. And right afterwards, we opened our own clinic and CrossFit gym. So I did competitive CrossFit for many years. And I love the sport CrossFit. There's a lot of intensity and the weights can be very heavy. So it's very important that you have good structural alignment.
I love CrossFit to see, because every time I see it, I get motivated mentally, but I'm not able to join it. And I don't know why. What's my fear? Maybe after 40, that will be my breakthrough. I love to see, and I actually love the community. Every time I go to your gym, I know everyone is so engaged. It's like a family. And I think the community and feeling that you're part of a tribe is the one thing that makes CrossFit different than any other discipline. Now, for CrossFit, you started, but how could you actually move from having an injury that it took you a year to recover to actually come into one of the top athletes that represented, like in a top level, national level CrossFit? How did you do this? Because I still haven't been able to get to that level.
I did a lot of work to strengthen my back. I think the blessing of the injury is that I really worked hard to get the full range of movement, but also to strengthen. Because since I was lacking in the mobility from the sacralization, I knew I needed to build up more strength around the joint.
Okay.
I did a lot of back extensions, a lot of Romanian deadlifts. And after this point and a lot of work just on my back, I was able to strengthen the joint. And now my lifts were good. I was able to deadlift 300 pounds, which was great for
Whoa,
me.
300
Yeah,
pounds. What's your weight?
125.
So you're doing more than twice your body weight.
Yes.
Wow, that's amazing. Wonderful, guys. If you hear this, I hope this inspired you. It's super motivational knowing that even if you have a congenital or idiopathic issue, you still have actually a habit and lifestyle that can actually change the trajectory of your back. Now, I wanted to know one thing. You have two kids. You know, a lot of the people that listen to this podcast are actually mothers. And I know, like, before pregnancy, sometimes we take for granted our health, and then we start becoming more aware about our body, especially our spine when we're pregnant, because carrying the load of a womb is actually about 15 kilos. It could be on the second trimester to the third trimester. A lot of load in the spine that could actually create lower back pain and even sciatica. So how was the transition between being an athlete to being a mother twice?
Yeah, so I think the biggest thing that changed for me becoming a mother is I did not have the mental drive to be as competitive. And at first, I thought this would be a bad thing because it was something that shifted in me, but I actually realized this was a good thing. So now my drive to exercise is more internal and more to fuel my mental health.
Okay, it's more like a balance, hormonal balance, kind of.
Yeah.
So back in the day, how many hours were you practicing to be able to reach to the national level on CrossFit Games?
Probably about 2 hours a day training on average. A lot of it was for me because I've been an athlete for so long. I was pretty good at doing all the high intensity components. I worked on my strength. But in CrossFit, there's a lot of skills you have to learn from Olympic lifting and gymnastics. So a lot of this required patience to practice the skills and the things that I was not naturally as good at.
Sure, like the handstands, right? Or like the push-ups on a handstand. Not only handstands walking, but let's just do a push-up. Why not? Oh, I see this. It's very inspiring that you as a woman you are able to actually to do all this. Now, I wanted to know, now as a woman that you are mother of two, your main motivation is mental health, and you are so inspired about this that you're actually taking a study, right, related to how emotions can impact our pain in our body.
Yeah, so I work with a lot of patients to help balance their emotional health, and I do it in two ways. So I look first and foremost at their nutrition. So I do very comprehensive blood work to look at their hormones, their nutrients, and I design comprehensive diet plans to balance. A lot of times when we have deficiencies, this can create a lot of issues with anxiety and depression. The second way that I work on this is through somatic therapy. And
Okay.
somatic therapy is when we have negative emotions stored in the tissue. And so I use different types of therapies through osteopathy and acupuncture to help bring these emotions to awareness. And I use both things in integration to help with any type of emotional issue, but a lot of depression and anxiety and past trauma.
Mm-hmm. And one more question before we wrap up our first talk together is related to the mental health and the back pain. Have you noticed that from the pandemic to now, most of your patients come to you with more back pain, more spinal issues, and also more disruption in the mental health? Do you notice a spike on these two?
People are so much sicker, and it's sad to see. A part of it is the side effect of the lifestyle right now, but what's really interesting specifically with back, and everyone, when we have any type of chronic injury, there is often an emotional component. And if you think about the purpose of the spine, the purpose of the back, it is often to create support in the body. And so sometimes when we are lacking support, and that can be different to everybody in different capacity, it can be related to a chronic back injury. So I always like to also look at the emotional component driving the injury, because our bodies are very complex and there is often emotional component.
Mm-hmm. Okay. When you get, like when you actually receive a new patient, you normally have a very comprehensive questionnaire where you actually go deep into emotions, or you just try to develop this conversation more spontaneously with your patients?
Every patient is different, and I always try to meet them where they're at. Some patients are very willing and very open to explore their emotional health, and some patients, this is something that they have not done before. So I like to start with the nutritional aspect to make sure we're correcting this, and then visit by visit, we start to dive into the emotional aspect as well.
Mm-hmm. Okay. And if you could give an advice to one of your kids now about fitness, what would that be? Only one advice, that is one piece of advice that you like, this is the number one that's going to keep you fit for life.
I think a big piece of this is to be in tune with your body. One thing I try to teach my kids who are now almost 3 and 5 is to see how they're feeling. So every day, if they go to the bathroom, they look at their poo, they tell me, Mom, it's a healthy poo. Or they tell me it's not. Or they tell me my tummy is hurting. Or they tell me my head is hurting. So I try to get them to develop insights into how their body is feeling as a tool. So using this to guide how much exercise they should be doing or what they should be eating as feedback. I, of course, think movement is very important, but at the end of the day, it's important how your body is feeling, and also to have something you enjoy and something that is motivating for you.
Mm-hmm. And this, like, self-dialogue or self-conversation with our body, it takes time to develop, right? Some people just numb themselves and they don't listen to the signs. So I think we encourage you, Michelle and myself, to perhaps take time to listen to your body by simply breathing and scanning your body from head to toe. This is something that I practice every morning. I have done 300 hours of Vipassana meditation, which allow me to simply see myself from a witness perspective for 300 hours. It has not been easier. but it's been just an experience for me to get in tune with myself and get to know when I'm actually pushing too hard or when I'm actually numbing myself or suppressing any emotions. So it's very important, especially like Michelle, she's a mother and she's teaching her two kids already about how to harness our emotions and to understand that we all are a balance between all the days. We're going to have good days, bad days, the heat and the cold, the light and the night. So we always like a contrast of sensations. And life is about experiencing everything. So thank you so much, Michelle. You are very inspirational to me. I think I always tell people, but maybe you never know, but I actually tell people that one of my inspiration to be who I am is you, actually. Yes.
That's so nice, Joa. And I'm so grateful to be on your podcast and to be your friend for so many years.
Thank you, my friend. For me, I actually, it's like, I mean, I have invited so many people for 4 years, since 2018. It's been 4 years. And I haven't invited one of my inspirations. It's like, come on. So it's like, okay, I'm going to invite Michelle because I think she totally deserves to be sharing her story and other people to know who she is deeply, not only as a naturopath doctor and osteopath, but also as a woman and why she started to do what she's doing now. So thank you so much for being vulnerable to show us your story. I know there is so much to go deep, and I am so excited to have you for 3 more episodes to share all this content about postural health, emotional health, and wellness. So if you guys have any questions and comments, please leave us any questions and comments to this podcast right here. We have the Spotify, we have the YouTube, we have all these versions. And also we have channels. We have the YouTube channel, and actually Michelle has her Instagram. Can you please tell us what's your Instagram to reach to you?
Yes, so it's Dr._Michelle_Basu Roy. So just my name. It's easy to search. I'm the only one.
Yeah, I'm actually going to add it on the notes of the show, and I also will add your website so people can get to reach you. For all the women, so you know that we have somebody to support you, especially on fertility. I know fertility is something that we're struggling a lot in the last decade, perhaps because we have so much toxic and external factors that are affecting our hormones. But we're going to go deep into this for the next episode. So thank you so much, my friends. I hope you guys had an amazing day. And remember that together we are stronger. Thank you so much, Michelle.
Bye.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.